Lisa's clothes were completely stripped off, and then she was forcibly placed into a large tub. A nearby nurse smashed a large block of ice, and the cold, shattered ice was dumped into Lisa's tub. Lisa was held down, unable to break free. To ensure that Lisa fully felt the icy cold of the water, the nurses brought over the tub's lid and prepared to seal her in completely. Lisa was submerged in the freezing water, feeling a deep sense of hopelessness as she realized there was no way out. Desperately, she looked at the woman next to her. The woman, in the same predicament, was frozen stiff, her face pale, and her expression vacant. The two of them were frozen, motionless. This method, known as ice water therapy, was used to treat mental illnesses. No matter how aggressive or uncooperative a patient was, as long as they were plunged into the ice water, within 30 seconds, they would become as docile and obedient as this woman. This treatment was inhumane. If a patient continued to resist, they would be immediately locked in a small, dark room by the nurses. 2 hours later, Lisa finally emerged from the freezing tub and returned to her room, but she soon realized that the women in the room didn't seem like real patients. Their behavior and thoughts were no different from those of normal people. Lisa began to feel confused. However, the next day, she witnessed something even more disturbing. A female patient was called into a room where several people were seated. The doctor began hypnotizing the woman. Suddenly, the woman's breathing became erratic, and then she collapsed to the floor, her body violently convulsing. The people around her watched the scene unfold, but not one of them went to help. The woman kept shaking and rolling on the floor. After a while, her lower body completely lost feeling. Seeing this, Lisa was filled with dread. She realized that this place was far from a legitimate mental institution, and she needed to find a way to escape as soon as possible. Lisa's attempt to sneak a look was noticed by the head nurse, who planned to lock her in the small dark room. At that moment, Lisa suddenly said something shocking. She told the head nurse that the ghost of her sister was currently in the room. Lisa accurately named the head nurse's sister and even knew that the woman had red hair. It turned out that Lisa didn't have a mental illness at all. Her true ability was clairvoyance, but she had been misdiagnosed and sent to the asylum.